Hello everyone and welcome to today's Fireside Chat. We're so happy that you've been able to tune in and join us today. So we are going to get started. I know we have a ton of content to discuss, and so I want to not waste any time. Before we dive right in, let me briefly introduce you to today's speaker. My name is Heather. I'm the Manager of Membership and Marketing at the Society for Public Health Education, or Sophe. And today we'll be speaking with Dr. C.J. Neely. She's the Assistant Director of Career Education at Johns Hopkins University. I think often when students are preparing for the end of the term, or if we're looking ahead for young professionals, there's always great career advice out there, particularly for the health educator. And so we want to tap into some of that today. So welcome.
Thank you. Thank you so much for having me.
Awesome. You're very welcome. Yeah, thanks for being here. So I want to go ahead and dive right in. Could you tell us a little bit really about maybe your brief background and the work that brought you to career services?
Yeah, sure. So I've actually had a long, windy road, which you'll probably hear if you talk to many individuals about their careers. So I actually am a biomedical trained scientist. I have a PhD in microbiology and immunology. And so for 12 years, I worked at the bench. And up until about 4 or 5 years ago, I was actually looking to pursue a path as a academic PI, which is a private investigator, basically running my own research lab at a research-intensive university. And at the time, I was at St. Jude Children's Research Hospital, working as a postdoc, kind of doing what I needed to do to prepare for that career. But at some point, I started to realize that I was on this path because I had been on it for so long, versus actually wanting to become a PI and actually wanting to do this as a long-term career. And I didn't think it was going to be the best fit for me. So at that point, I hadn't really thought about other career options. And so at St. Jude, there was a really unique feature where there was a postdoc leadership council, and on that council, there was a chair position for career development. So I decided to run for that position. I was elected, and when I took that position, I really took it so I could create a career exploration series, so I could explore careers that I was really interested in, and I was hoping to use this volunteer role to kind of figure out my next steps if I wasn't going to pursue academia. But I quickly realized when I was in this volunteer role that I loved working with other trainees, helping them understand what their real passions were, helping them successfully transition to the next step. And so when I was closing out my postdoctoral fellowship, I made a decision to pivot from biomedical research over to career and professional development.
Excellent. Well, thank you. I think what's perfectly interesting and wonderful about your story is that it's like a lot of us, right? When you begin to shape your career, you find that you may not end up exactly on the path you originally intended because other things pique your interest or new opportunities arise. So I think that's completely relevant. So thank you so much for sharing your personal story. So let's talk career services. We've got maybe some students or young professionals who might be on the cusp of graduation in less than 8 or 9 months. We might have some folks who are just starting out their first or second year in a career. Can you tell us, when you're looking for that first job, when you're looking for maybe your second job, what are some of the crucial skills that you need to have at the ready? What are some of those things that are going to be good value adds when you're marketing yourself for the job force?
Well, I would say regardless of the type of position that you're looking for, one thing that I have heard time and time again working with public health employers is that excellent communication skills are essential to be successful in the field. So this could be both written communication and oral communication. And as I said, it really doesn't matter the specific role or responsibility you have. In almost all positions within the public health field, communication is really key.
That's perfect. In light of that and alongside some of those, what do you think are extreme benefits to having someone who is maybe a new professional or early career professional or a new student hire? What are some of the benefits to having someone still fresh of their educational knowledge joining your team?
Well, I really think that one of the biggest advantages to a new student hire or someone who's earlier in their career is that they're so eager to learn, and that is a huge selling point. Everyone's coming in with some really good knowledge, but there's obviously, a gap in what they know that they're going to learn on the job. And employers really like that, individuals who are earlier in their career are going to be excited to learn that new task, and that's something that's going to be of a value to an employer.
Perfect. I wanted to know if there's, I think a lot of times still starting out, and even myself, I would say I'm maybe early to mid career and like looking at some different things, but professional development is key. Constantly being a learner, constantly learning new things, growing in just subjects and content areas that can continue to expand your value as a hire, but also just in the work that you do and enjoying the work that you do. So do you have any sorts of like resources or maybe give us some tips or tricks on how to put our best foot forward, maybe when looking for a job or in in sort of that space?
Well, as for kind of getting information, like keeping on top, one thing that I really like, because just like everyone else, we're very busy. So there's great books out there, but I don't always have time to read a book. So when I'm trying to learn something new, whether it's professional development related or something that's subject matter related, I really go to things like podcasts or webinars, such as this series, where you can get content, that's very easily digestible, but still of great value. So I always tell people to kind of look into their field and see what sort of information there's out there. I know within the public health field, there's a number of universities that have podcasts that give overviews of topics, so you can listen to it on your commute to work or if you're on the bus that you take to school every day. So that's a great way to get content. Did that answer your question?
Yeah, for sure. I completely relate to that as well. I have a pretty decent commute, and so for me, podcasts are key. I think that you're right. It's an excellent way to download content. You can find things both personally and professionally in so many different areas where you want to grow or learn more. I think that that's extremely valuable. Now, let's say someone was looking for a new job. What do you think would be some key facets to the resume? Can you lend some thoughts or some suggestions as to maybe how a resume should be formatted or sort of put together in a way that is going to best highlight the skill set of that particular candidate?
Yeah, I think that this is a great topic to talk about. So oftentimes if you're applying for a position online, the first impression you're making with that employer or that hiring manager is your resume. And so you want to make sure that your resume really does represent you. And so a couple of things that I really do suggest is to make sure that you have a really visually appealing resume, that when an employer looks at it, it's easy for them to read. Sometimes I'll see resumes that are just really chock full of words, so it's hard for the eye to kind of figure out where the information is. And one of the ways to make it visually appealing is to use things like headers and bullet points to make it visually appealing. And so we have an example up here from the Johns Hopkins Bloomberg School of Public Health Career Service office. It kind of demonstrates some sections that we encourage our students to use when formatting their resume. So in addition to formatting, I really encourage people to tailor their resume for the specific job that they're applying for. So, and what I mean by this is that, you're applying for a position, they write a job ad telling you explicitly what they're looking for in a candidate, and you want to make sure that your resume demonstrates that you have those qualities. oftentimes what I'll see is someone will write a resume that contains every experience they've ever had, and maybe a lot of irrelevant information, which is it's important, but it's not necessary to the job. And they're expecting the hiring manager to read that document and pull out the necessary information to make the determination that they're actually a good fit. But it's really your job as the applicant to make it easier on the other person by clearly demonstrating that you have those qualities. And so, again, tailoring it to the job, being very clear and concise in what you have to offer. And then when it comes to your individual bullet points for each experience you have, I tell people to really focus on achievement statements. So instead of saying, responsible for X, Y, Z, really put down what you did, how you did it, and what results came of this. And if you can include numbers, that's great, whether that's like increasing efficiency by X percentage, or if you were doing survey design and then administering the survey, how many people did you survey? Or if you're working with data, how large was that data set? Those sort of numbers can kind of indicate the magnitude of work that you've done in the past and indicate what you could kind of do in the future. And then other things that I like to suggest is to convert your Word document to a PDF. The worst thing is if you spend all of this time writing a resume and then you upload it into some system and the Word isn't compatible, and so it completely reformats it, and then I, as a hiring manager, open it up and it just looks a mess just due to that conversion. So if you save it as a PDF, then you know that whoever looks at it is going to see the same thing as you. And then finally, proofread. I cannot say this enough, especially if you're taking the time to edit your resume and make those tweaks for each job you're applying for. With each revision, there's a likelihood that you might have a typo, and so you would hate to have that typo be the reason why you don't make it past HR, or that they extend an invite to someone else over you. And so even if you need a family member or a classmate to do a proofread, not necessarily for content, but for grammatical reasons, I would highly suggest that.
Perfect. Yeah, I think that's extremely valuable, and proofreading is key. I think even when you're on the job, making sure that you're trying to avoid as many errors as possible. Some jobs have a lot more writing involved, and so that's certainly something that can be evaluated as part of, not just how well you're doing, but what kind of best foot forward you're pushing out there when you're sharing content. So that was a lot of information. Go ahead.
No, and I was actually going to say that that's a really good point. Whether we realize it or not, our resumes are actually a sample of our writing. Mm-hmm. And so an employer, if they see mistakes in your resume, that could be an indicator that you'll make mistakes if you're writing a document for them.
Right. So you've given us a lot to think about here. Are there any sort of definite don'ts that you think would be important for resume writing?
So one thing that I've noticed when working in the public health space is that each country kind of has different standards on what to include in a resume. Here in the United States, one thing that isn't common, and I would encourage people not to do, is include their photos. So I've had some international students who come from other countries, and I've looked at their resume, and they have a photo right at the top. But here in the U.S., it's not a standard, so I would remove that. Another thing I had touched on earlier is, I would really encourage people to create tailored resumes versus a single generic resume that they're applying for all positions. Again, employers have so many applicants for each position, and so if the reasons why you're qualified are kind of buried in your resume because you're using the same one over and over again, they're most likely not going to see why you'd be a perfect fit for the role. Also, I wouldn't have every single experience or accomplishment you've ever done. You really want to tailor the position, your resume to the position, so include the things that are most relevant. Obviously, you don't want a large gap in employment, but there are ways to highlight how a specific job, like not every responsibility needs to be in there, but the ones that are most relevant to the position that you're applying for. And finally, just
Absolutely.
I don't like to use personal pronouns in my resume, things like I, we, and my. Instead, I create, for each of my bullet points, they start with a strong action word versus I created, it started with created.
And this may seem weird, but should that be present or past tense? Does that matter?
For jobs that I've done in the past, it's all past tense, but a job that
Okay.
I'm currently in, I do in present tense.
Okay. Okay. Interesting. Yeah, I always get a little curious about that. So that's a lot about resumes. I think that's extremely important for folks that are looking for different roles or wanting to even enhance their current role if they're reevaluating their even their job description as part of an annual review or something like that. These can all, I think, be good takeaways for someone still just working or growing in the profession. But as you and I probably both know, there are folks that, and even in the story that you gave, your personal story in the beginning, you may start out somewhere and then completely switch gears. Do you have any maybe a good mantra or personal story or a YouTube video that sort of explains how this career journey is just not linear? I think so much of us, or so many of us, want to find that dream job and stick around there and do that for a while. And sometimes I think that's not reality. And I just wonder if you have anything to share that might kind of resonate with that or help folks that are on this journey better understand what to look for and how to kind of go with the flow and be flexible in that particular sense.
No, I think that what you said is very true. These linear career paths are very, very rare. And really what happens is most of us actually make pivots or changes throughout our career, and multiple times. And one thing that I tell people all the time is to really lead with curiosity. And what I mean by that is maybe you're in a current position and someone talks about a project or an opportunity that comes up, and it could be even within a professional society, something that you can do like through volunteering that sounds really interesting. Well, look into it. If you're really curious, see what it's about, learn more about it. And then if you can, try to get involved. Or if it's a job, maybe you're interested enough to go ahead and apply. I find that it's oftentimes when we're exposed to new things or an opportunity that we didn't even expect arises, it leads us to a place we never even anticipated. And oftentimes, again, if we're really leading with curiosity, we're going to end up being in a place that we're happier with than a place that we probably mapped out 5 or 6 years ago.
That's excellent. I would completely 110% agree because I think that you never know what the future holds, and as things change, you want to kind of go with the flow with some of those other elements. So for folks who are joining us today or for folks who may be watching this later, what do you think in your role, in the experience that you have working with folks in the public health profession or health education, what are 3 takeaways that they should take from this conversation, 3 main points that if they're just tuning in right now that would be really relevant for them and something that they should know?
Well, I think the first is that it's really unrealistic to have your entire career mapped out. Instead, you should really just follow your passion, be open to new opportunities as they arise. And this will, again, take you in directions you've never even expected, but I think will actually make you happier in the end. So your career really is a journey. And that's kind of exciting. At least that's the viewpoint I like to take. Second is a lot of what the job search is about or how our careers progress is about who you know. So who you know can be as important, if not more important, than what you know. Therefore, I really encourage people to try to build professional relationships as you move forward with your career. And then one of my last tips would be is to really think about this idea of networking. So I think the word networking can really have a negative connotation, but really what it is building relationships. So your current network could be your classmates, it's your professors, but you can easily expand your network to include alumni and local professionals if you just lead with curiosity. So if you go on a place like LinkedIn and look at, your university, there's actually alumni listed on the LinkedIn page for your university. You can kind of explore and see who's working in a specific area, either like by location or by subject, and kind of see what sort of careers are out there. What are alumni doing? And oftentimes people are happy to talk about themselves and share about their experience. So I really encourage people to try to build their networks through informational interviews, just, again, leading with curiosity. Again, I think this will open opportunities or help people learn about positions that they didn't even know existed.
I would, again, completely agree. I'm a pretty strong networker myself. I think that that's extremely relevant when you wanted to stay connected to both people in the profession or to kind of, like you said, learn about different aspects of what's going on in your more broad profession or other areas that might be tangential learning. One thing, I just had a random aside, and you don't have to have a right answer for this or whatever, but I'm just curious because being in a position, how much networking is like too much? Do you think that like when you're seeking a job, there's a better amount than when you're actively working a job, or if you're maybe a student versus a more seasoned professional? Is there any particular like best practice or best recommendation on sort of how often to do the thing? Do you know what I mean?
Yeah, no, so I always tell, when I was working with the School of Public Health, I would always tell students, network when you don't need a network. Because if you wait until you need a job, then it seems like you're trying to get something from someone. And you don't want to come off, and that's not what the purpose of networking is. If you're reaching out to alumni or local professionals, your goal is not to ask for a job. Your goal is to get to know this person, build a relationship, get information. What is nice, though, is once you have that network, if you find out down the road, 3-4 months down the road, a year later, that there's a position open at this organization and you have previously talked to someone, you can go back to them and say, I really appreciate our conversation. I found, the information you shared so helpful, and it actually made me really interested in the company, and now I see this role is available that I think I might be a perfect fit for. Do you have any tips on the application process or any insight you might want to share? And you may be surprised that the person is willing to help you. That could be doing an internal referral or sharing your resume with the hiring manager if they happen to know that. So again, you're not asking for their help. You're just thanking them for the information. And, if you've built that relationship, they may be willing to help you. And a lot of times, again, getting positions, landing jobs, and moving in careers is a lot to do with who you know.
Yeah. No, I totally agree, and I think that's a great way of looking at it because you're right. It's like the used car salesman kind of thing, right? When you know you need something, you come off with a different sense of urgency or need than when you're coming at it from a more lighthearted perspective, just trying to gain information and gain understanding. Sort of that leading with curiosity, as you mentioned earlier, has a very different feel to it. So I completely agree that that's a great way of looking at how and when you should be doing that networking work. So we've got a couple more minutes. We've got about 5 minutes left, and we do have a few folks that have joined us. So we're going to go ahead and open it up for questions. We have a chat box that I will let folks ask any questions if they have any. And in the meantime, I want to go ahead and just talk about a couple of Sophe events. Here at the Society for Public Health Education, we host 2 main events every year. We have our fall event, which is the annual Advocacy Summit. That's coming right around the corner, October 19th through the 21st. Registration is still open if you wanted to register for that. And this year we will be talking about a public health education approach to the opioid crisis. So if that's an area of research or interest for you, by all means check out our website and learn more about the summit. And then we also just opened up registration for our annual conference. So we're going to be in Atlanta March 17th through 20th of 2020. So do save the date, and if you're interested in joining us for that, there is continuing education contact hours available for CHES or MCHES if you happen to be a certified health education specialist. Do log on, check out more information, or you can always reach out to me here at Sophe through membership@sophe.org if you have any questions. So I don't see any questions popping up just yet. I think that one thing for me that I'm always curious about is in reference to sort of this job searching element. How do you go about I know we talked about the resume, but are there other ways that you mentioned it before, like that informational interview? Can you maybe expand on that just a pinch more and tell us kind of what that looks like or how you would go about setting something like that up?
Yeah. So I'm a huge fan of informational interviews. I am an extrovert, so maybe that works to my advantage. But I think everyone, regardless of your personality type, really should be doing these informational interviews. And so even though they have the word interview in it, it really is a casual conversation with someone. And so, as I said earlier, you can reach out to someone that you're interested in learning more about, maybe about their career, their organization. It could be a local professional. It could be someone, as I said, an alumni, or even a faculty member that you've had class with, but you don't really know a lot about their research. And so if you have someone in mind, you can just email them directly, asking them if they'd be willing to meet with you, whether it's over coffee. If they're not local, you can always do it over the phone, and just ask for about 15 to 30 minutes of their time, and if you're looking to expand your network to someone who maybe you don't know, I think LinkedIn's a great way to identify the people that you might be interested in, or even I think that professional conferences are amazing. So, for example, if you were going to one of these upcoming events that your organization is hosting, you might be able to see who the speakers are, or who the attendees are, and ahead of time, reach out to someone that you're interested in meeting with and ask if they'd be willing to meet with for coffee during the conference. And then when you actually once you actually get together, whether it's over the phone or, as I said, meeting for coffee, come prepared with questions. You're going to start off with telling a little bit about yourself, but then after that, most of the time, you're going to be asking the other person questions. Again, leading with curiosity. What is it that you actually want to know? And I usually bring paper and pen and kind of write down things here and there, but I also make sure to be an active listener and try to really hear what they're saying versus worrying about what I'm going to say next. And again, it's a conversation, so it's going to go back and forth. Oftentimes, if someone mentions resources or mentions other people's names, I'll include that. And if the conversation goes really well and I hit it off, I ask the person if they could introduce me to the person that they mentioned in the conversation. And so then my network's kind of working for me. And after every informational interview, I always send a thank you email right away. I connect with them on LinkedIn if I haven't done so already. Sometimes I might send a resume if it makes sense in the context. And I'll say things like, it was great talking to you. As you know, I'm graduating in a few months. I've included my resume in case you know of anyone who's hiring who might be in the field. Again, you're not asking for a job. You've already kind of started building that relationship and you've kind of casually put it out there. If they know of an opportunity, feel free to share. And another thing I like to ask is, or I tell students to ask, is instead of asking, is there a job open at your organization, you may ask if there's internship opportunities, because sometimes there are not formal internship programs, but there are these informal opportunities that you can only learn about through conversations.
That's a great point. I think finding those nuanced ways as you're building that relationship to tap into that is crucial. I agree. And so we're pretty much out of time, but I just had one quick question that I wanted to finish us off with. We've mentioned it a couple of times. I have my own thoughts about it. I think it's an excellent resource. But do you think everybody should have a LinkedIn?
I personally think it's a fantastic way to network professionally. I'm a big fan of it. I do think that you should have some social media presence. It doesn't necessarily have to be LinkedIn. It could be Twitter. I know that's becoming quite popular. You don't have to be on all platforms, but you really should be marketing your accomplishments and staying connected with people in your field through a social platform.
Yeah, I totally agree, and I think that LinkedIn is definitely one of the most professional versions of that, to be able to expand and sort of outreach to a network and make that virtual real. Well, I guess that concludes for today. I just wanted to thank you again so much for joining us on behalf of the Society for Public Health Education. We are so grateful that you could take the time out to spend some time with us and share your knowledge of career services and with our audience. We will be posting this to our YouTube channel, so do check it out there. And thank you so much for joining us. All right, folks, this will be the end of today's chat.
Hello?